My name is Kelly Smith. I'm a registered respiratory therapist and a registered nurse in pulmonary rehabilitation at Charleston Area Medical Center, and I have worked here for 24 years. I would take any of the general sciences, the biology, chemistry, any of the labs if they're offered, mathematics such as algebra, computers, but I would say probably the biggest class that would be very beneficial starting right now would be a communications class, because in healthcare, communication is like a key factor. On more of a personal note, I had two family members that had cystic fibrosis, and that's the genetic lung disorder that causes the excess mucus, and they died at a very young age. And so 26 years ago, I decided to go into the respiratory care associate's degree at the University of Charleston, and I graduated then back in 1992, and then in '99 I pursued my interest into the nursing field, and I've never looked back. I love my patients, their family members, their loved ones. Seeing them achieve something that they didn't think that they could achieve is just so rewarding. Knowing that we impact their lives just a little bit keeps me coming back every time. The most challenging part of our job is probably just knowing how devastating pulmonary disease is. Our patients, they usually have more than one comorbidity, and that doesn't include the stress, depression, anxiety, and that scares them. And our challenge is trying to get them to overcome some of these fears. And it's not going to happen overnight, but we slowly help them work through with either the breathing retraining or the panic and relaxation classes to cope these fears. Well, pulmonary rehab, we run 4 days a week. We run 2 days at the exercise area, and then the other 2 days are patient orientation, new patients. Here in the exercise area, what we do is when our patients are usually deconditioned, when their muscles are deconditioned, they burn more oxygen. So our job in rehab is to slowly build those muscles, mainly the large muscles, the legs and the arms, back up so they're not using as much oxygen. And that's where the exercise comes in. So on Tuesdays and Thursdays, they'll come in and we do their vital signs, blood pressure, heart rate, sats, put them on oxygen, put them on a heart monitor. Some patients require the glucose to be checked. And then we start with some warm-ups, and we do them sitting to help conserve energy, because, you know, everything burns oxygen, so we want them to conserve as much energy. And after the warm-ups, we move to about 5 different exercise rotations. They start out as low as 1 minute and build up to as much as 15 to 20 minutes, and it's dependent on where they are in the course. During the exercise portion, we monitor their oxygen and their heart rate the entire time. And then after the exercise portion, we cool down with some strength training, and then we go into the education portion, which is about anywhere from 20 to 45 minutes, and it's usually geared towards how they can self-manage their disease at home. And of course, at the end of the day, documentation, documentation, documentation. Pulmonary rehab or respiratory care is a wonderful career. I have been in it since 1992. I would encourage anyone to join this field if you are willing to work as a team. We work with doctors, nurses, therapists, occupational therapists, family members, and if you're willing to be able to advocate and teach and are caring, this is definitely going to be one of the fields for you.